This is Dr. Vikram Singh. I am a nephrologist at Subik Hospital in Dehradun. I've been in practice for last 25 years in this town. Uh, Today, the topic for discussion of this session is how we can remain active or being active while somebody is actually having diabetes. So diabetes is a long-term disease. We all know that. So apart from the drug management, the treatment with the drugs, there are certain lifestyle modifications which we need to adopt to take care of our diabetes and its related complications. Next, please. Next. Yeah. So as I've already said, that diabetes is a complex and a serious disease. Managing every day can be actually very challenging, but small changes in your day-to-day daily habits will help you to navigate it smoothly throughout your life. The various associations have emphasized the role of exercise and being active while somebody has diabetes or even without having diabetes. Such behavioral changes also helps in better control and avoiding complications of diabetes in our patients. Next, please. Yeah. There are many things which can be done as a part of lifestyle modification in patients who have diabetes. One of them could be healthy eating. We will come to the details a little later. Being active in general, continue monitoring your sugar levels at home as well as in reference to the hospitals also. Regularly taking your medications. If you have any problem solving with your nurse or a consultant or your doctor, and try and reduce the other risk factors like cardiovascular disease or heart problem associated with diabetes. And how can we easily try and cope up with this problem of long-term chronic disease easily. Next, please. So in individuals with diabetes or pre-diabetes, adoption and maintenance of increased physical activity are an important part of sugar management and keeping patients healthy overall. Recommendations and precautions could vary from individual to individual depending upon his or her health status. Next, please. So we will, in next few minutes, we would try and understand that how the being active or doing physical activity or exercises of various kinds is going to help us in managing our diabetes or keeping the diabetic patients healthier. Next, please. So as we know that these two terms sounds to be similar, physical activity versus exercise. So in technical terms, they may be a little different. When we say we are talking of physical activities, is a generalized term, kind of an umbrella term, which includes all movements that increases energy use. So that energy expenditure is used in such kind of activities. This is an important part of diabetic management. So in general, a diabetic patient will have to be more active physically. The exercise is more of a specific form of physical activity. Say, I would say that you could do a treadmill, you could do a brisk walking for say 30 minutes or so. So such a kind of specified physical activity would be called as exercise. Both physical activity and exercise are important. They should be tailored to meet the specific need of each individual. So sometimes we cannot make generalizations कि सबको ऐसा ही करना है. Every diabetic will have to behave in a similar way because each patient will have its different needs. So we have to individualize our advice to the patient, or patient has to discuss with his or her doctor in detail. Next, please. Say, for example, somebody who has symptomatic heart disease, the very aggressive exercise may not be advisable. Next slide, please. So, as we all know, especially those who are already having diabetes, that the regular exercise actually helps in improving the glucose control, because it helps you to spend your calories. It contributes to the weight loss, and losing weight will have a better sugar control in these patients because of the various mechanisms. It reduces the cardiovascular risk factors. That means the chances of heart disease would actually come down. Somebody having heart attack is lesser as compared to the person who is not doing the regular exercise. Overall well-being of the patient is also much better when you are doing regular exercises, whether you have diabetes or you do not have diabetes. Next, please. So people have tried to classify the various kinds of exercises and physical activities. This is very commonly known term, that is aerobic physical activity, or the aerobic exercises involves repeated and continuous movement of large muscles. That means simply you're just trying to walk or climbing the stairs. So such as walking, cycling, jogging, and even the swimming. Resistance exercises are when you are trying to move against the gravity. So you're trying to lift a weight or a weighing machine, or an elastic resistance. You're trying to pull on an elastic band kind of thing, as we have sometimes seen in gyms and all. Flexibility involves all improving the all range of movements at various joints. So you could be bending forward, you could be moving all your limbs in all the directions. So that would make your body more flexible. Balancing would means that it's kind of an as we see in patients who are doing yoga, you are trying to maintain your balance. That means you are trying to make your leg muscles much stronger as compared to the when we were not doing such kind of activities. Next, please. So exercises could be aerobic against the resistance, and it could be flexibility as well as the yoga type of exercises. So what does the recommendation say as far as the physical activity in diabetics is concerned? It is suggested by American Diabetic Association, that is ADA, that 150 minutes or more of moderate to vigorous intensity aerobic activity per week. That means you should be doing a very brisk walking, at least 150 minutes or more in a week, or at least this should be divided between 3 days in a week. You should be doing this activity. You may not do it every day. Not more than two sessions should be consecutive. So that means once we have done it today, you could take a break for 1 day or so. Shorter duration of, or the minimum 75 minutes per week of vigorous exercise activity may be sufficient for those who are younger as far as the age is concerned, and otherwise medically fit. That means they are probably not obese, or otherwise they do not have any other complications like heart disease. So next, please. Then subsequently the ADA, or the American Diabetic Association, recommends that 2 to 3 sessions per week of resistance exercises. So you should be doing all kinds of exercises. The first one was that aerobic exercise, where we were doing brisk walking, cycling, and many other things like that. These are the resistance exercise, as we see in this slide, that 2 to 3 sessions per week on non-consecutive days. So they recommended that you should not be doing it every day. So you may take a break for 1 day. You can do aerobic exercise 1 day. Another day you can do the resistance exercises like weightlifting and so on. Next, please. Subsequently, the another recommendation is that all adults, and particularly those with type 2 diabetes mellitus, should decrease the amount of time spent in daily sedentary behavior. So one should not be sitting for a very long time, or lying down in a bed, or sitting in a sofa relaxing there. So sitting at one place not more than 30 minutes is advisable. So after 30 minutes, you should be changing your posture. You should be probably getting up and maybe walk a few steps. Next, please. Then subsequently, ADA also recommends flexibility training as well as balance training. We remember the initial slide said that there was aerobic exercise, resistance exercise. Then the exercises like Surya Namaskar and many asanas like this, this makes your body more flexible, and it is recommended to do them 2 to 3 times in a week. for adults with diabetes. Yoga may help us to maintain the better flexibility as well as maintaining the better body balance. Like one in the yellow color in the center, somebody is standing on one leg, is trying to maintain the balance better. Next, please. So in adults with type 2 diabetes, interrupting prolonged standing is strongly recommended. So you should not be sitting for a very long period. Preferably, you should get up and walk few steps every 30 minutes or so, but at least definitely not beyond 1 hour. Because there are many people who keep sitting at one place, watching television, doing their office work for 2 to 3 hours at a stretch, which is not good. 15 minutes post-meal walking is also advisable in patients with diabetes. 3 minutes of light walking every 30 minutes. As I said, that after every 30 minutes, you should be getting up, move around in your office, move around in your house, and do some other work during that time. Next, please. So prolonged sedentary activity is not advisable. How can we try and prevent or maybe delay the onset of diabetes in our patients or in our general population? So it is recommended that we should be doing, that means they are talking of people who do not have diagnosed diabetes as of now. So people should be advised to structure lifestyle interventions. So that means lifestyle modification or lifestyle intervention is extremely important, both in prevention as well as the treatment and management of diabetes. So when we talk of those structured lifestyle interventions, that means exercises, they recommend that 150 to 175 minutes per week of physical activity, and dietary restriction of the fat should be below almost 7% of the total calorie requirement. So such kind of activities may help us in delaying the onset of diabetes. Those patients who are high risk of developing diabetes, like obese, somebody who has had parents having diabetes or family history of diabetes, and so on. Next, please. So we need to make behavioral changes in our day-to-day life, because once we are used to that sedentary life, we are probably lying down in a sofa or sitting in a chair or lying down in a bed for a long time. We need to modify those activities actually. Can I have the next slide, please? Yeah. So wearing a device, as we all know that there are a lot of electronic devices available these days, which can monitor your physical activities. Pedometer is one such device where you know that how many steps you walk today. Using a daily step goal of almost 10,000 or more is predictive of increased participation. That means person is doing very well as far as his physical activities are concerned. Adults should avoid taking less than 5,000. So minimum steps one should take is about 5,000, preferably more than 7,500 steps a day, if possible up to 10,000 at least. So that will help us in preventing and delaying the onset of diabetes, as well as if you already have diabetes, will help you in managing it better and keeping you healthier overall. Next, please. So as we said that we could take help of various gadgets which are available these days, which will help you to monitor that how you are doing as far as your exercise or the number of steps are concerned. Next, please. There are a lot of problems that one is not able to do the exercises. That means there are a lot of barriers to do the physical activities. Next, please. So we will see how we can take care of them. There are people who say, just I don't have time to exercise 30 minutes a day because I'm very busy. I have to work till late in the evening. I have to go to the office so early in the morning. So you have to fix up your slot for the exercises. Do as much as you can. Make physical activity as a part of your daily routine, because work will go on every day. If you miss your exercise part, it will have a adverse impact on your health. Next, please. I have never been active. Don't discount your day-to-day activities. There are people that say, for example, you are not able to go for a walk, but you may be doing a lot of activities in-house. Maybe homemakers, the ladies or our mothers and sisters at home, they are already doing a lot of activities at home. So that also should be counted as a part of physical activities. Choose the activity which you actually enjoy, be it a walking, be it a cycling, or be it doing some other work, which will involve some kind of body movements. Next, please. I'm too tired after the work. So take a rest, take a break, but do not neglect doing physical activities. Next, please. There are people who keep saying that maybe the exercise may make my situation worse. Please remember that getting enough physical activity is important for everyone's general health. So generally, it won't have an adverse impact on your health. Of course, if you have any doubts, you can consult your treating doctor and take an advice from him that how much exercise I should be doing, which is the better exercise for me to do, and things like that. Next, please. So one should not be afraid of doing exercises. ये एक तरह का बहाना हो जाएगा कि मुझे नहीं करनी exercise. I am too shy to exercise in the group. There are people who do not want to go to the park. They do not want to participate in the walking in the parks and maybe roadside on a footpath or so. So choose an activity that you can do on your own. You can get onto your rooftop, start walking there. You can walk inside your house itself. Remember that everyday activity you do on your own, like gardening, household chores, I said a little earlier also, that also is counted as an activity. So your body should be moving. Activities must go on, whatever kind of, whichever you enjoy, whichever you are more comfortable with. But please avoid prolonged sitting, lying down for a very long time. That will have an serious consequences. Next, please. I don't want to have sore muscles. That means if you do a heavy exercise, one is likely to have pain in the muscles. So start slowly, go slowly first, and then gradually increase your number of steps or activities as tolerated by you. Next, please. So you do not have to walk 10,000 steps in a day. You can start with 200, then 400, 500 like this. Then some people say that I'm afraid of my blood sugar being too low. Yes, there is a genuine concern, especially those with diabetes, having kidney failure or kidney insufficiency. They should keep a watch on their sugar values. If you are doing a heavy exercise, you should be having something to eat very near to you. If you have any symptom to suggest low blood sugars like sweating, ghabrat, palpitations, you have kind of an apprehension, or you're feeling extremely weak, either you can check your sugar and then decide, or you can just eat something at that time. So please avoid hypoglycemia or being low sugar, because that is sometimes a very serious complication of diabetes, especially in those patients who have impaired kidney functions or poor kidney functions or renal failure. Next, please. I don't have motivation to exercise. I don't have any real good reason to do the exercise. You can also join an exercise group in such a situation so that you see people doing it. Maybe you also that I also can do it. Remember all the benefits that come with the physical activity, as we discussed a little earlier, that exercise is actually going to help you. It is part of your treatment in patients who have diabetes. Next, please. Those who have health related complications other than the diabetes, say somebody has heart disease, somebody has a problem with their legs, nerves, and all those things. So somebody who has eye complications related to the diabetes. So one may avoid very busy roads, so that if your vision is actually poor, if you have retinopathy, say something like hemorrhage inside your eyes, you could avoid a very heavy weight lifting and very an exercise which will probably transiently elevate your blood pressure for some time. So such kind of precautions in consultation with your treating doctor can be taken, but that is not an excuse to not to do the exercise. So exercise has to be a regular part of your life, especially if you have diabetes. Next, please. Because eye complication is a very important and common complication of diabetic patients. Other health-related issues like kidney involvement, it is the second major organ involved in patients who have diabetes. You could have albuminuria. Somebody says that I'm feeling weak because I'm losing protein in the urine. You may consult your doctor who will advise you, or a dietitian who will advise you the amount of protein you could actually take when you have proteinuria or microalbuminuria, or various stages of kidney diseases like microalbuminuria, overt nephropathy, and patients who are on dialysis, end-stage renal disease. Their diet may be little different, or even the exercise program may be little different as compared to because their exercise tolerance may not be as good as it is seen in patients who do not have these complications. So you will have to be in close association with your hospital treating doctor or your health advisor, any paramedic or a dietitian or a physiotherapist for that matter. Next, please. So diabetes, another third important complication apart from eye and kidney involvement, is the impact on the nerves. You have a lot of numbness, sometimes pain in your extremities, or you could have a foot deformities, foot ulcers, diabetic amputations. There are people who have to chop off their toes, or maybe sometimes a leg, because of the infection and gangrene related to the diabetes. So their exercise program will have to be tailored accordingly. So that means there comes the regular role of your treating doctor as well as the treating paramedical staff. Next, please. So if somebody has arthritis, that means joint problem, you may not have a heavy impact exercises. You could do a lighter exercise, or just to increase your range of movement of your joint. So that means your physiotherapist will actually guide you better. Next, please. So in the end, we would try and conclude that both physical activity and exercises are important for people with diabetes. They should be tailored to meet the specific need of each individuals. At least 150 minutes or more of moderate to vigorous exercise intensity of aerobic activity per week is advisable. When we say vigorous activity, say for example, you are walking, we call it as brisk walk sometimes. So when two persons are doing brisk walk, if they try and talk to each other, their voice should not be so clearly audible to each other. That means your speed should be such. Then only it will be having a more positive impact on your health as well as the sugar control. 2 to 3 sessions, at least 2 to 3. If you are unable to do it every day, you can at least divide these 150 minutes or 300 minutes into 2 to 3 sessions in a week. Do all kinds of exercises like aerobic exercises, that is vigorous intensity aerobic activities, and these resistance exercises like lifting weight and all those things, at least 2 to 3 days in a week. Prolonged sitting is extremely dangerous. It should be avoided and interrupted every 30 minutes. So you will have to get up from your seat every 30 minutes for blood glucose benefit, and maybe walk for about 2 to 3 minutes after you get up from your seat or the chair. So flexibility training and balance training, as we said, that a lot of yogas and various asanas will keep your body flexible, and you will be able to maintain a better balance, because falls are extremely common in elderly individuals. So if your leg muscles are actually weak, you need to train and strengthen your leg muscles so that you are able to maintain a balance better. So such kind of exercises should be done at least 2 to 3 times in a week. So doing 150 minutes of aerobic vigorous activity, 2 to 3 sessions per week of resistance exercises, as well as the flexibility and balance maintaining or balance training is recommended 2 to 3 times in a week. Behavioral changes that can be used to promote the adoption of maintain a lifetime physical activity. So you need to give up some of your old bad habits, I would call them, that being sedentary is not good, not only for the diabetics, it is also extremely bad in patients, in people who are also not having diabetes. So friends, diabetes is a very serious disease, a very common disease in fact, and India is having a lot of diabetic population, and in next few years we are likely to be called as diabetic capital of the world. So earlier we started, better it is, because the habit of exercise should be incorporated into the day-to-day routine from the very early part of the life. So that's all I think I would like to say as far as the physical activities and lifestyle modification, maintaining good body weight, as well as keeping your sugar under control. Both physical activity as well as exercise are important. As we said that physical activity is any kind of movement. Exercise is a specified, tailored kind of exercise. Both of them are important. Both of them should be done. They should be tailored according to the specific need of each individual. As we discussed a little earlier, that each individual will have a different exercise tolerance, different requirement of the exercise which one will need to do. So it has to be individualized. So that means your coach or your doctor or your physiotherapist will actually help you. Then you can continue according to their advice. So total of 150 minutes or more of moderate to vigorous physical activities. Same thing probably again here. So friends, thank you so much. Is that all? Yeah. So thank you so much for listening. Please take a good care of yourself and lead a healthy life. Thank you so much.